Thank you. Come now to question number 8 in the name of Dr Ayesha Verrall.
Thank you, Mr Speaker. My question is to the Associate Minister of Health and reads, does she stand by all her statements and actions?
Mr Speaker, yes, in particular those that relate to my absolute commitment to the SmokeFree 2025 targets and to providing practical, targeted help so that smokers who are addicted to nicotine can stop.
Practical.
Supplementary. Why did she say in the House yesterday that her comments to media were, quote, truthful at the time, end quote, because, quote, being offered something and asking for something are two separate matters, end quote, when the document she signed on December 20 shows that she both initiated the advice and accepted the offer to provide that advice by circling an option for further advice on freezing tobacco excise tax?
Mr Speaker, I apologise if this answer is a long-worded answer, but it is an answer around process, so I think it's important to clarify what actually happened. When I received this delegation, I provided a range of information to officials, including things like Hansard records and previous policy positions around smoke-free and vaping to help guide conversations. The health paper came back, setting out a number of areas on which I could be provided advice, and I marked I wanted advice on all of them, as I consider it important to be broadly informed before making decisions. That health briefing referred to proposals and notes. They were not my proposals, to be clear. They were not things I had written. This was general information I had provided to officials, and I'm sure they can verify this. I haven't yet received any of that advice, and I certainly did not specifically request a proposal on excise freeze.
Supplementary. Why did the Minister say yesterday that the truthfulness of her statement rested on a distinction between being offered and asking for advice when the evidence shows she did both?
Does not. Words back.
Mr Speaker, I think I've answered the question.
Does she agree with the Prime Minister, who Radio New Zealand reported as having said yesterday that the government will not be pausing increases to tobacco excise tax?
Of course I agree with the Prime Minister, and it is advice that we are considering, and when we receive that advice we will make informed decisions.
So can the Minister clarify, is the Prime Minister correct that the government will not be pausing increases to tobacco excise tax, or is she still considering advice on that matter the Prime Minister has ruled out?
I think I've answered the question, Mr Speaker, but I am committed to receiving broad advice, and we will make recommendations on the best options. We will make advice on the best options to enable people to quit smoking.
Thank you. We come now to... Oh, sorry. Taku to go.
Taku first. Kia ora tātou. Does she agree that dropping cancer screening for Māori by 10 years is an equitable approach to address the inequity that exists for Māori with cancer? If not, what is her government proposing to address this inequity that Māori have faced for decades?
Mr Speaker, I'm absolutely committed, which is the reason we do not want a broad brush approach. We want targeted campaigns that will enable the most marginalised and most vulnerable to quit smoking.